we're discussing a little bit about toxicities from immune checkpoint inhibitors, in particular pulmonary toxicities. So this is something that we have a great interest in. This is, of course, one of the most serious side effects of immune checkpoint inhibitors. And in real-world settings, we see the incidence of lung toxicities to be as high as 10%, particularly in lung cancers. And so we've done a variety of studies looking at some of the risk factors, but one of the key questions early on was, what is the real-world incidence of pulmonary complications? And when we think about pulmonary complications, of course, the most common one is pneumonitis, which is inflammation of the lung. But there are some other pulmonary complications in which it's less clear as to what the role of the immune checkpoint inhibitor is. And so this is a pharmacovigilance study that we undertook in 2021 to 22, and it was published in 23. Ugochi Ebinama, who is one of our trainees, is the lead author, and Swami Iyer, who's one of our oncologists at MD Anderson, was the senior author. And this is a study where we used a pharmacovigilance database. So it's the Food and Drug Administration Adverse Event Reporting System, or FAERS. And these are adverse events that are reported in conjunction with a specific drug. And in this case, we focus on the immune checkpoint inhibitors. And we perform something called the disproportionality analysis, which is basically where we look at the relative incidence of a given toxicity with one drug compared to other drugs. In particular, we were interested in pneumonitis, and what we did is we looked at the rate of pneumonitis with these various drugs. And as kind of mirroring real-world practice, most of the ICIs were given to treat lung cancer. And we saw the highest risk for pneumonitis with the PD-1 inhibitor nivolumab. And some of this may be also driven by how nivolumab is given, where it's often given with the CTLA-4 inhibitor ipilimumab. We also saw pleural events, which is something that there's been some more recent studies on. This is something that we don't typically associate with immune checkpoint inhibitors, but yeah, we did see a higher risk of the sort of serositis type of event with, again, nivolumab and pembrolizumab being the highest. And we also saw a higher risk for ICI-induced sarcoidosis as well, too. We were also interested in airway exacerbations, and this is something that's come up frequently, and particularly in our patients that have COPD and asthma. We're interested to know whether the immune checkpoint inhibitors actually make this worse. And we've had a couple of cases where the immune checkpoint inhibitors induce eosinophilia in the airways, and this can make pre-existing asthma worse. And in fact, when we look at this sort of large database, we found no association of immune checkpoint inhibitors with worsening COPD exacerbations. And to my knowledge, there's no data showing that in any cohort at this point. So that's reassuring. Even though these things happen very rarely, generally speaking, the drugs don't increase the risk for airway complications in a large scale. There are, of course, a lot of limitations to a pharmacovigilance database. It's limited by reporting bias, and so a lot of times you see over-reporting in some cases. In some cases, you see underreporting because no one thinks to report this to the FDA database. And so these things need to be taken with a grain of salt, and ultimately these findings need to be validated in proper retrospective and prospective cohort studies. But it was kind of a interesting, to an extent, unbiased view of the real-world incidence of these toxicities.
Yeah, thank you very much for that summary. Thank you, Dr. Sheshadri, for your time and your contributions to advancing research in this important area. I encourage everyone to read the full article, which is available at the JIPO website. Thank you very much again.